Hello. Right, welcome. Thanks for coming. I know it's out of term and all that, but we have a really special guest today. I'm Stephen Jenkins, and Professor in the Social Policy Department, closely associated also with the III. Really pleased to welcome today Bruce Meyer, who's the McCormick Foundation Professor in the Harris School in Chicago. He studied all sorts of things under the banner of poverty, inequality, tax policy, safety net programs, and measurement errors, we should hear. I first came across Bruce's work way back in his 1990 econometrica paper about unemployment duration. So I was sufficiently impressed that I had coded up and stated his estimator. It lives on. But of course, Bruce has done much more since that, related to what sort of things a lot of people in the room do. Really important work on comparing measurement error, data quality and measures of consumption and income. And more recently, he and his collaborators done lots of innovative work on survey errors using admin data linked to survey respondents. And today's topic, under the housing banner and so on, is and homelessness and so on, is really closely related to the stream of work. And so I salute Bruce because he's somebody who takes data quality issues really seriously, which is unfortunately, I would say, rather uncommon. Anyway, and another thing to keep in mind, most of Bruce's applications are to the USA, so reflect on whether or not findings travel internationally. I'm sure the issues do. Yeah. Thank you, Bruce. Thanks.
Thank you, Stephen, for the very kind introduction. So I'm going to talk about joint work with a number of former graduate students, and I do need to give you a quick disclaimer that all of the results that I'm going to show you have been through disclosure review. The Census Bureau requires us to say this. I am going to try and provide a lot of first-order facts that might be useful for policymaking, and I'm going to quickly go through them. The work emphasizes better data in measurement and combining survey data with administrative data. A third thing it emphasizes is using broader measures of well-being than just income, things like consumption, mortality, housing characteristics, and other outcomes. I'm going to try and show you enough so you can understand how we're able to come up with our results, but not full details. Hopefully at the end, if there are particularly things that didn't make sense or you can't figure out how we could possibly arrive at that conclusion, I can try and fill in a lot of the details. So let me start with public opinion. I was involved in conducting a public opinion poll, and it found that the vast majority of people believe that poverty in the US is worse than it was 25 years ago, and an even larger share believe that homelessness has increased over the same period. Interestingly, most thought solving the problems of poverty and homelessness were the responsibility of government, but thought that individuals and their choices were a major cause of poverty and homelessness. And there were sharp differences by political affiliation. The US is increasingly polarized in that way. Now, I'm going to compare what people believe to what I think are the facts. If you look at official poverty, and so second fact I want to talk about is official poverty has not risen. And official poverty in the US compares pre-tax money income, the poverty threshold set 60 years ago that are adjusted for prices using an index called the CPIU. And the rate 25 years ago was just slightly higher than what it was in the past year. And this decline happened despite the fact that in calculating poverty, the official rate doesn't include most of the things that we do to reduce poverty. So it doesn't include in-kind benefits, which the US has increasingly turned to, and it doesn't include tax credits, which the US has increasingly turned to. And it uses a price index that substantially overstates inflation because it doesn't account for substitution fully, for improvements in quality of goods, and takes a while to incorporate new goods in the price index. And finally, as I'll emphasize, the source of the data for our official price, our official poverty measure, the current population survey, has high and rising underreporting of income. So many sources in the survey are substantially underreported. I'll show you some numbers on that. And this survey is the source of our official income, health insurance coverage, and employment statistics, as well as poverty. So it's a very well used and important survey. Now, if you look at more accurate and comprehensive measures of poverty, they say absolute poverty, poverty relative to an absolute threshold that's only adjusted for the true inflation level, has fallen sharply. If you account for taxes, so you get a disposable measure of income, and you account for in-kind benefits, principally housing benefits that the government provides and food benefits that the government provides, not accounting for medical benefits, because well, here you would think maybe morally you just shouldn't count for them because they're just something that fundamentally should be provided. In the US, we think that people don't value them at nearly their cost. So how they're handled is quite controversial, so I'm leaving them out here. But once you account for taxes and in-kind benefits, poverty fell by more than 60% between 1995 and 2016. And I'm ending in 2016 because of data limitations. The data that I'm using is very hard to obtain. And I'll describe it in more detail. The fall in poverty has been uneven across groups. It's been particularly pronounced for the elderly because half of pension income doesn't get reported in the main survey. And it's been smallest for single adults who aren't targeted by many government programs. If you look at consumption measures rather than income, consumption being a more direct measure of well-being, you're looking at what people are buying in the way of housing and food and other goods. that type of measure shows an even sharper decline in poverty. These results are confirmed by looking at very tangible measures of well-being, like housing standards. This is kind of my favorite way because you talk about income, you talk about consumption. It's not very tangible to the average person. But if you look at characteristics of the housing that the bottom 20% lives in the US, the characteristics that the bottom 20% lives in now looks like, the characteristics look like those of the middle 20% of 30 years ago or 15 years ago, depending on what characteristic you look at. So in terms of number of rooms, you have to go back about 35 years before the current bottom 20% housing looks like what the middle was back then. For having air conditioning, a dishwasher, washer, and dryer, you only have to go back about 15 or 20 years before the middle looks like the current conditions of the bottom 20%. And if you're looking at housing that doesn't have leaks in the roof or in plumbing or cracks in the walls, to have bottom 20% now look like the middle, you'd go back about 25 years. So one reason that I'm going to emphasize bringing in administrative data and not just relying on survey data is that the survey data are really sharply underreported in our most used survey that's the source of the visual poverty statistics. What this shows is for 8 sources of income or government benefits, the share that's recorded in the survey. And in gray, it's what was true in 95, in brown, 2016. At top, we have earnings. Then we have OASI, which is retirement pensions. DI is disability insurance. SSI is basically disability benefits for those who don't have a work history or for the elderly poor. UI is unemployment insurance. This is cash welfare. EITC is tax credit for those who work, principally those with kids, and SNAP is food assistance. You'll notice that all of these bars are less than 1, which means less than 100% of what was paid out and what was recorded in the national accounts actually shows up in the survey when you weight up the survey reports. And you'll notice that for every source except for 1, the number there, the share that's actually recorded in the survey, is smaller in 2016 than in 1995. And the exception, which is SSI, the second smallest of the sources of income. Earnings is the biggest, OASI is the second biggest. SSI is the second smallest. It is confused with DI. So the reason reporting went up for that is more and more people mistakenly reported that they were getting this disability benefit for low-income people rather than the disability program that's for people with a long work history. So this went down a lot, that went up a lot.
So one question,
Yes.
your opinion or your judgment. Behind this, you assume or you are saying that the national account numbers are the benchmark and are okay. What's the confidence interval you would assign to national accounts to read this number?
It's fair enough that the national accounts are not perfect. But for many of these, what we're looking at is just the audited sum of the benefits paid out by a government agency. And that's true for all of these here. Earnings is more complicated. And let me defer that. I'm happy to talk to you about earnings later. So how do we solve this problem of underreporting? We link administrative data on all of these different sources of income from various government agencies. So IRS is our tax authority. That's where we get most of the information. SSA is the administration that pays out retirement and disability benefits, and also SSI. We get food assistance from state agencies. We get housing assistance from our Department of Housing and Urban Development. We have most of these back to 1995, but not everything. As we go further back in time, our administrative data become less complete. So here, what I'm showing is declines in poverty over time. And this is from 1995 to 2016, where in gray, it's just based on the survey data, but with a better adjustment for inflation than the official one. And then in maroon, it's using the combination of the survey and administrative data. And we call it using the kid. We had to come up with some cute name for our project 10 years ago when we were trying to come up with funding. And one of my co-authors came up with the name Comprehensive Income Dataset Project, or affectionately the kid. So that's why it's labeled such here. And you can see that for various groups, there's a different decline over time. The most pronounced over time is for the elderly. And if I went back a slide, you'd see that only half of pension income gets reported. And that's why accounting for underreporting in the survey matters so much for the elderly. And on the other hand, single individuals aren't eligible for many government benefits, so correcting the reporting of them just doesn't have much impact. Now, you could also, rather than correcting income, which for a long time I thought was a fool's errand, because maybe it was. It took me roughly 20 years to get all the data to do what I'm showing you. Something simpler is just to look at consumption data. And that tends to show a similar pattern of a sharp decline in absolute measures of poverty over time. And here is the official measure, which is pretty flat, doesn't have a real trend going back more than 50 years. But if you look at consumption, there's more clear of a pattern. That's in brown if you use the official price index, and then in gray if you use a price index that accounts for the overstatement of inflation in the standard price index. And they're all what we call anchored to 2015, so they cross there, and the thresholds are proportionally adjusted for the different levels of the source measure, because consumption on average is a little less than income because of savings, and we're removing part of spending that we would argue is more appropriately classified as investment by people, like spending on education. And there's some who've argued that the price index for the poor should be adjusted more, that its prices have gone up more over time for the poor than others. And if that is what you want to incorporate, then that would be something between the brown and the gray. So how do you understand why income and consumption give you different measures? Well, part of the story, one that we've argued for most of the past 10, 15 years, is that it's underreporting of the income. And you can see that when you correct the income measures, the patterns over time look more similar. We have a paper that takes the same data set and matches in administrative data to the data set which has consumption and income. And we're able to show that the distributions are much more similar when you bring in the administrative income data to correct the survey reports for the income sources that are badly reported. So we essentially are substituting the administrative data for the survey data in a data set that has both consumption and income data, and we could show that they line up much better. So that's one direct way. We, in the past, didn't really put much weight on the idea that another reason that consumption might give you a different picture of poverty over time than income is that people save and dissave so that consumption doesn't equal income for many people, but we didn't think that that was really that relevant at the bottom, because most surveys that look at the poor find that they just don't have much in the way of savings. More recently, we found a pretty substantial exception to that pattern that during the COVID pandemic, the US paid out huge stimulus payments. $1 trillion in unemployment insurance, $1 trillion in cash payments, most of it targeted towards the bottom. Either targeted towards the unemployed who tended to be at the bottom, or in terms of fixed payments with exceptions for high income people. And if you look in recent years, you seem to see that there was substantial savings, even at the bottom, that many of these stimulus payments weren't consumed right away. So that's part of the story for the deviation between income measures and consumption. Now, I tried to emphasize that I was talking about absolute poverty, the level of the number of people below some absolute threshold only adjusted for inflation. But you might think when people are responding to that survey that I started with, they're thinking more about a relative poverty measure, and that's why they're arguing poverty is worse now than it was 25 years ago. And if you look at measures of relative poverty, they've tended to decline a little bit, but not nearly as much as absolute poverty. And here I'm emphasizing measures that account for taxes, account for in-kind transfers. That is most of what we do in the US to reduce poverty. It's those programs. So that's the good news, but inequality at the top has clearly risen, and that's what I'm going to show here using consumption data. And here I'm not going to the top 1% where it would be even more extreme. I'm looking at the bulk of the distribution. So I'm comparing here the 90th percentile to the 50th percentile. The higher series here is after-tax money income. And then the lower series are measures of consumption. And all of them are showing a rise. So it's clear that there's been a rise in inequality at the top. But if you look at the bottom half, while income suggests a rise over time, if you look at consumption measures, which I'd argue are more reliable here because of underreporting, these measures here, the income measure isn't adjusted for underreporting. The consumption measures tend to show declining inequality in the bottom, that the 10th percentile has risen relative to the 50th. The 50th over the 10th has fallen. Another important fact for policy is that well-being at the bottom is worse in rural areas and away from the coasts. This is quite relevant for policy, which is thinking about things like, should benefits be adjusted for local housing costs? Should poverty thresholds be higher in California and New York City than rural Mississippi? And there's a lot of intuitive reasoning behind the idea that you should have higher thresholds and maybe higher benefits in California than in other places. But what I want to argue is that we should look at broader measures of well-being in deciding who is the most needy, who to target, who is the worst off. And if you do that, the case for adjusting poverty thresholds or benefits for measures of local housing costs falls apart. Basically, housing reflects what you pay for, the cost of housing reflects what you pay for. So in places where housing is more expensive in the US, education, healthcare, availability of retail is better. There's a reason people want to live there. And that seems to be even more true for low-income people. So what we precisely do is we pull together as many data sets as we can linked to individuals. And we think about adjusting poverty thresholds for local prices. And we look at 70 indicators of well-being in 10 domains. In doing this, we hold the share of the overall population that's poor constant. So we're looking at reallocating in terms of the definition who's poor, those from low housing cost areas to high housing cost areas. And we look at whether that means the population you're calling poor is better off or worse off by these 70 indicators. What we find is that the vast majority, almost all of the indicators, if you do that, suggest that your new definition of poverty gives you a group that's better off in terms of measures of their health, mortality, education, long-term income, characteristics of their housing, their net worth, their wealth, whether they can pay for food, and it's the minus signs in the last column are kind of our scorecard. Though a minus sign means that if you reallocate who you're calling poor based on housing costs, you get a less deprived group of people you're calling poor based on these indicators. So we thought it would be more split, but almost everything pointed in the same direction. In short, it's better to live in a small apartment in Manhattan than live in a big house in rural Mississippi, is maybe a shorthand way of saying what we find. So why has poverty declined over time? That's our sixth fact. And much of that is due to the expansion of government programs. Social Security is our biggest program. It has the most poverty reducing effect. Much of the other effect comes from the in-kind benefits and tax credits that I've mentioned, SNAP, which is food assistance, housing benefits, and tax credits that are principally for families with kids. The survey data are inadequate to understand this issue because they understate the poverty reduction of government programs because they understate the receipt of the government benefits. So here's the reduction in poverty from different programs. It's labeled poverty reduction of government programs, but the way we've actually calculated it is to start from the current situation and take away various programs. So this is really, it's the percent increase in poverty if you eliminated these programs. And what you see is that using the linked administrative data, the poverty reduction for many of these programs is almost twice as big for disability insurance, for food assistance, for housing benefits. All three of those, the poverty reduction is almost twice as big. And you see a similar pattern if you combine programs. Looking at all government programs, poverty would be 1.5 times as big if you eliminated them. And when you account for underreporting, that's another 60% increase that would occur if those programs were not around. Government programs can also be part of the problem. I don't want to say you want to just expand everything. A good example is our welfare reform of the 1990s. If you look at what happened after we changed our system to be more work-oriented, the employment of low-educated single mothers increased quite dramatically. It went up by about 2/3, increased from about 45% to 70% in a short period of time. For those with less than a high school degree, also went up for those with a high school degree, much less impact for the more educated. And how did those at the bottom fare? One concern I had, and other people did as well, was that you move to a system that relies more on work. Aren't there going to be people who are left behind? And the changes were designed to have some safety valves. So a substantial share of people were exempted from having to work, and the welfare rolls were cut dramatically, but not eliminated. What you see is that those at the bottom had their living standards, again here measured by what they're able to purchase in the way of food and housing, other goods went up most for those at the bottom. So the bottom deciles did the best. So that's that was quite encouraging. And there've been a lot of other, well-designed studies, quite a few of them randomized controlled trials in recent years, who have looked at direct cash assistance. And there's some real notable cases where they've had very little effect. And these are some of them. Baby's first year, there isn't a year there. There's a whole series of reports and studies that have come out in the last few years with the finding that substantial cash assistance for a very deprived group can have little impact. So I'm going to switch now to homelessness. I think part of the reason in the US people perceive poverty is getting worse is because, like London, there are a lot more encampments. There is a lot more visible homelessness in the United States in the past few years than there was 10 years ago or 25 years ago. First, I want to emphasize that literal homelessness is fairly rare. By that, in the US, we mean in a homeless shelter or sleeping in a place not meant for human habitation. The best data says that it's less than 0.2% of the population, with the unsheltered less than 0.1%. How can we know this? What are the data sources on those experiencing homelessness? Well, there are two sources. One is the one that you'll see the most. It's called the point-in-time counts, which are counts done at the end of January each year by local organizations called continuums of care. There are about 400 of them across the country. And the counting is done mostly by advocates and little trained volunteers, and the methods are in some cases not very scientific, and they vary across geography and vary over time. I've been involved in them. Most people on our research team have done them at least 1 year to learn about how these counts are done. There's also census counts that our research group relies on. And these are done in a uniform way by professionals, but only done for 2010 and 2020. These data you can link to all kinds of other data. So they're potentially much richer, but they're restricted. We've been analyzing the 2020 data recently, and I don't think that there's been any public release of those data at all. And we've written a few papers with the 2010 data, and there's almost nothing that's been made available. Let me say that these statistics say that homelessness is not obviously higher than in the past, but there's been a rise in the unsheltered who are very visible. So, and if you go back about 8 or 10 years, over that stretch, it's clear there's been a rise in unsheltered homelessness. So the most visible form of poverty, maybe the most extreme, probably the most extreme version of poverty, has risen in the last 8 to 10 years. And it's particularly visible in California and Washington State and Oregon, where much of the increase has been focused, and the data suggests a decline in Florida and Texas over that period, but I'm not convinced that the earlier Florida and Texas data were right, so it may not really have been a decline. Here's the share of the population homeless according to these point-in-time counts as a share of the population. Total in blue, sheltered in black, and green it's unsheltered. And you can see that there's been this rise in the share of the population that's been unsheltered over the past 10 years or so. And I think that's what is most obvious to people and maybe the most concerning. The official numbers for sheltered have these huge upticks, which we have a paper arguing you should basically ignore because they're asylum seekers. They were put in temporary shelters. So it's a completely different phenomena. And those numbers have already gone down back to trend, but those numbers haven't been released. Let me skip ahead. Deprivation for this group is quite severe. So even though it's not a big group, their income is low over a dozen years. We follow them by linking them to administrative data. We can link 70% of the sheltered to administrative data over time and 40% of the unsheltered. They also have very high mortality. Here's income over time. You can see that it's quite low, never more than, this is a comparison group. The homeless are these two lines here, never more than $10,000 a year over the dozen years that we're following this group. And that's including transfers. We don't have one of the key income sources till 2010. That's why there are those series beginning there. Employment among those who are homeless is surprisingly high. This is formal employment that we see in administrative records. So about half do some work that shows up in tax records. Mortality is very high. So this line is people who were homeless in 2010 that we then follow for a dozen years. This is a poor comparison group, and then this is the general population that's housed. Mortality is about 4 times as high for the homeless another way to express that is those who are experiencing homelessness have mortality of people about 10 years older than they are. Let me just move on, skip this last part, and just go to conclusions to give people time to ask questions. So public perceptions of changes in poverty, I think are incorrect, but seem more accurate for what's happened to homelessness. Some of the recent changes in poverty are encouraging, changes in homelessness less so. Single men, I didn't talk about all of our results here, seem to be a consistent problem. There's been a rise in non-employment for this group that's been pronounced. The policy evidence is mixed. There's some bright spots, some programs that have worked quite well, like expansions of free healthcare for the poor, but unconditional cash assistance, there's a fair amount of evidence can have little effect or even be counterproductive. So let me stop there and take questions.
So it was all looking good till the end, wasn't it? Till the housing stuff. So we have about 5 to 10 minutes for questions, comments, reflections. Is that more than just the US? Everyone else? Chico?
Just two quick, thank you, Bruce. It was very interesting. Two methodological questions that I may have missed. So
Yes.
you've got this extra income, right, in the administrative data for the benefits that you're going to distribute in the surveys or do some. So my question is, how is that done? So are you able to match individuals?
Absolutely. So all of these records, I didn't talk about it. It's my fault that we're not going through them in detail. All of these records have an individual identifier, the same individual identifier. The Census Bureau takes Social Security numbers, if they have them, and scrambles them in a way that prevents a researcher from looking up someone they know. And if they don't get the Social Security number directly, which is true for most of the survey information, they get it from name, address, and date of birth and gender. And they can do that for about 90% of the survey records, about 99% or higher for the administrative records. It's also impressive that they can do it for 70% of those in homeless shelters and 40% who are in found on the street, in tents or at soup kitchens or food vans. And we spend a lot of time validating the methods. For example, there are administrative data from shelters for 3 cities that we use. And we go and look and see if those who were in the shelters at the time of the census count also appear in the census. And we find more than 90% of them in the census data. we also, look at the employment and earnings in our tax records for the people in the administrative shelter data from these cities and compare it to the same employment and earnings data for the people that the Census Bureau says are in shelters. And that's those that they can link. And the lines are right on top of each other in almost all the cases. And we're following their earnings or employment over a dozen years, and you in most cases can't really distinguish between the samples. So it looks like the data are surprisingly good.
Thank you. Yeah. I had a second one, but let me skip it in case other people have.
You started with the problems of the CPS ASEC.
Yes.
So, and you've had to do all this special stuff to get the right answer.
Yes.
So what are the recommendations to the Census Bureau about improving CPS ASEC?
They should stop asking these questions about government benefits that the government has the information on already. It would allow them to use more accurate information. It would shorten the survey, probably improve the quality of responses to other questions. But the statistical agencies are odd animals, and our Census Bureau is really, at least those doing household surveys are really survey shops. That's what they're used to. And they don't want to rely on data from some other agency. And they are worried legitimately about potential errors in the administrative data. And sure, there'll be some small share of benefits that were maybe transferred to the wrong EBT card. But relative to 50% of benefits not being recorded in the survey, if a percent or two are misrecorded for some reason, and I'm not sure that we even think it's that high a rate for some of these benefits, would be a lot better off. But the agencies are very slow to.
But you have no national statistical office to bang heads together. I mean, it's not a.
We don't. We have a toothless statistical policy office in the federal government that only has a dozen employees and almost no authority.
I have two short questions. One, you said that you showed that the survey is very good for earnings in capturing national accounts earnings. You could say something more, you said. And second, with your merged data set, are you able to estimate mortality rates that you did for the homeless people over the whole distribution?
So let me talk about homelessness and mortality first. So for 70% of the sheltered, 40% of the unsheltered, we get this transformed social security number, and then we can look in the mortality records for them for the next dozen years, for as long as we have mortality records. And what I sometimes get asked about at this point would be, well, what about the homeless? Are they identified when they died? And I had a research assistant spend a couple weeks on this, and it turns out that there are very few unidentified deaths in the US. There are people who disappeared. That's a separate issue. But there are very few people who turn up dead in the city and their name can't be figured out. So we think that the records are really quite good. And the first issue, earnings, wage and salary earnings, we think are pretty good, and self-employment, no. The federal government thinks that only about half of self-employment gets reported. And then there are complicated ways, but with large standard errors. If standard errors were reported, and they're not. Or the degree of underreporting of self-employment. And it's based on audits. So essentially, reported self-employment income in the national accounts is scaled up based on audits of a small share of the self-employment, where someone goes over their business records and tries to figure out what their daily income is. And that's done through the fair amount of error.
There's no estimate of the standard error or earnings total in the national accounts. You have not seen that regarding this estimate?
People sometimes, what they do is they look at revisions because they revise these numbers from time to time to try and get some idea of the uncertainty, but no official standard errors are reported.
Peter, are there any online questions? Okay, going on. We're over time, so I could draw the seminar to a close. Thanks, Bruce, again for a comprehensive overview of what's going on. Thanks very much.